first mentors that I've had in pediatrics, and I was so inspired by their work to support vulnerable children that I realized that's what I wanted to do. One of them said, "It's better to build strong children than to repair broken men." And I think that quote sticks with all of us because we want the future to be better than what we've had. So what better way to do that than to improve the life of a child? I did my undergrad here, and I started volunteering as a 16-year-old actually at Sick Kids. I love the institution that I'm part of. I really liked being at Toronto. I grew up in a small town, and Toronto was the first time that I really saw firsthand how you could have neighborhoods worlds apart next door to each other. And I think I wanted to be able to come back and carry what I had started in undergrad here. Hands down the people. I think I love my residents. I think they're both my supports, they're both my creative partners, and I love that I can sort of turn my head any way and there's going to be someone there. They're literally like sparks waiting to ignite something in you. There's all these people carrying different ideas and perspectives, and it's just a wonderful environment where things get creative. Global health doesn't necessarily mean you have to go to the other side of the world to start. There's a lot of vulnerability right here in Canada, and truthfully in the downtown east side and in some of the reserves I worked in northern BC, the conditions were just like what I saw in a slum in India. It made me ashamed to be a Canadian, and that's what inspired what I think is my global health interest. I'm one of the resident leads on our outreach clinic for the uninsured in Ontario, where we see children and families who have no health insurance who have come from literally countries all over the world, and we're doing everything from immunizations to finding them a shelter to getting them early childhood development programming and finding lawyers to advocate for their visa. So that's sort of been what I've been doing here, and I think as I go forward I'd like to take what I've learned and be able to engage in more medical education initiatives abroad. I think there's a lot we can learn from other countries and other cities because we have a lot of issues here too. And to be able to understand how other cities in the world have been able to operate with low resources, I think is just as valuable for us to learn as we can share our information with them. The reason I signed up is because like I said, I had never been abroad, and the reasoning I had for that is I know we can leave a big social footprint when we go with good intentions into a community, but into a community that's not ours. So I wanted to make sure that I was as prepared as I could possibly be and as reflective as I could possibly be before going abroad to any community. What I found from my experience with the Global Health Education Initiative is that it's allowed me to be reflective with, like I called my colleagues my sparks, and they're exactly that in the classroom as well. We have great discussions where we can reflect on what does it mean to go to this community? How do you identify needs in the community when you're not actually part of the community? And then how can you be part of the community in which to then create a sustainable change? I think that's been the most valuable learning experience for me. I do see myself now taking a skill set that I've learned from just my residency and my medical training, combined with the perspective I've gained from the GHEI, to be able to go abroad now into different communities. As I've gotten more experience and I've spent more time talking to people who have worked in different communities, exploring different communities, I'm pretty excited about work that needs to be done, and there's a few countries I think that are close to my heart.